everyone, welcome to this YouTube channel, a channel for amazing facts and information. In this video, we are going to talk about top 10 most common addictions. Watch this video till the end for a better understanding, and make sure to subscribe, and hit that notification bell so you never miss any of our future uploads. An addiction is a chronic dysfunction of the brain system that involves reward, motivation, and memory. It's about the way your body craves a substance or behavior, especially if it causes a compulsive or obsessive pursuit of reward, and lack of concern over consequences. Drug addiction is considered a disease that impacts brain circuitry and behavior, and it is classified by an inability to control drug use. Addictive drugs act on the pleasure center in the brain, causing a shortcut to reward that, when repeated, can change the way a person processes information. Drugs' addictive qualities may be enhanced by how good they make a person feel when using them and how bad they may make users feel when they wear off. Chronic drug abuse can induce drug dependency, which leads to withdrawal symptoms and drug cravings without the drug's presence. Over time, addictions can seriously interfere with your daily life. People experiencing addiction are also prone to cycles of relapse and remission. This means they may cycle between intense and mild use. Despite these cycles, addictions will typically worsen over time. Here are the top 10 most common addictions in the world. Number 10. Sedatives, barbiturates. Millions of people around the world are prescribed barbiturate sedatives, commonly known as sleeping pills, to treat tension and sleep disorders. Every year, thousands of prescription users build a tolerance and ensuing addiction to drugs like Lunesta and Ambien. Sleeping pills can produce mind-altering effects that lead to continued abuse. They produce a wide spectrum of central nervous system depression ranging from mild sedation to coma. They come in pill form but are also abused by injecting a liquid form into the user's body. There are many types, but some common generic names are amobarbital, pentobarbital, phenobarbital, secobarbital, and tuinol. If not treated, barbiturates can result in hypothermia, circulatory failure, and death. Number 9. Inhalants. Inhalant addiction is particularly dangerous because inhalants are volatile toxic substances. The effects of these substances, gasoline, household cleaning products, aerosols, are intense and can have immediate consequences including hospitalization or death. Chemicals prevalent in inhalants can linger in the body and brain long after stopping use, making complete recovery more difficult. Number 8. Street methadone. Despite the fact that methadone is intended to help heroin and narcotic painkiller addicts control cravings, it is still often abused. It had a low pleasure score on the factors for dependence but ranked high in psychological and physical dependence. It is available as a tablet, oral solution, or injectable liquid. According to the Department of Justice, some of its street names are Amidone, chocolate chip cookies, Fizzes, Maria, Pastora, Salvia, and Wafer. Withdrawal symptoms include anxiety, muscle tremors, nausea, diarrhea, vomiting, and abdominal cramps. Number 7. Amphetamine. Used to treat attention deficit hyperactivity disorder and narcolepsy, amphetamines are stimulant drugs. Illegally produced amphetamines, such as meth, are sometimes mixed with caffeine, sugar, and a binding agent and are swallowed, smoked, snorted, or injected. Soon after consuming the drug, users may feel energetic, confident, happy, and have an increased sex drive. However, it also increases heart rate and causes dry mouth and teeth grinding. Withdrawal symptoms usually disappear after a month of not taking any drugs. They include nightmares, restlessness, aches and pains, exhaustion, depression, paranoia, confusion, and irritability. Number 6. Benzodiazepines. Benzos, such as Valium, Xanax, diazepam, and Klonopin, are prescribed as mood-regulating drugs to manage conditions like anxiety and stress. Those developing an addiction to these drugs oftentimes aren't aware until they can't function normally without the substance. Benzodiazepines are especially dangerous because of their powerful impact on the brain's chemical makeup. Withdrawals can be deadly without medical assistance during detox. Examples of benzos include Xanax, Valium, and Restorol. Within 1 to 4 days of discontinued use of benzos, users may start experiencing insomnia and anxiety. After that, for the next 10 to 14 days without the drug, people might experience panic attacks, sleep disturbance, dry retching and nausea, headaches, and muscular pain and stiffness among a host of other unpleasant symptoms. Number 5. Heroin. Heroin's severe withdrawal symptoms make beating a heroin addiction a difficult task. Treating heroin addiction typically requires a combination of therapy and medications to help manage symptoms of withdrawal and cravings. Heroin users feel a rush of euphoria after injecting, snorting, or smoking the drug. It doesn't take long to develop a tolerance to heroin, and users will need to keep increasing their dose to get the same effect. Nasty withdrawal symptoms motivate users to continue using the drug. Common signs of withdrawal are severe muscle and bone pain, diarrhea and vomiting, restlessness, cold flashes, and uncontrollable leg movements. Long-term effects of opioid addiction can result in loss of white matter in the brain, which affects decision-making and behavior control. Number 4. Cocaine. The white powdery drug is typically inhaled through the nose and is a stimulant made from the leaves of the coca plant. Cocaine increases dopamine levels in the brain, and frequent use stops normal communication between nerve cells. That means your brain becomes less sensitive to dopamine and users must increase the amount they use to feel happy. Common withdrawal symptoms are depression, nightmares, and insomnia, fatigue, and slowed thinking. Users who snort cocaine may experience loss of smell, nosebleeds, runny nose, and problem swallowing. Those who ingest the drug can have severe bowel decay. Crack cocaine, which is cheaper and more intense than regular cocaine, is responsible for many crippling addictions and ruined lives. Number 3. Marijuana. The legalization of marijuana in some states has made the drug's use more socially acceptable. This trend can distract people from marijuana's addictive potential. Rates of marijuana addiction might also be growing due to increasing potency, over 60% over the past decade. 30% of marijuana users show signs of a marijuana use disorder which is associated with dependence. Withdrawal symptoms may appear including physical discomfort, decreased appetite, mood and sleep difficulties, cravings, and restlessness. People who start using marijuana before 18 are up to 7 times more likely to develop a marijuana use disorder. Number 2. Alcohol. The social acceptance of drinking can make alcohol addiction hard to spot. Despite its legal status, alcohol's potential for abuse opens users up to many health risks and possible addiction. Alcohol abuse has numerous negative consequences. In addition to deaths from liver disease and alcohol overdose, drunk driving claims thousands of lives every year. Over 86% of adults have consumed alcohol. It ranked high in the pleasure category, and it makes sense that most people consume alcohol to relax or celebrate. However, excessive drinking has a long list of associated health issues including high blood pressure, alcohol poisoning, stroke, memory problems, depression, and anxiety. Withdrawal from alcohol can cause delirium tremens which can result in death. Other horrible symptoms include tremors, hallucinations, and seizures. Number 1. Tobacco, nicotine. Nicotine addiction may not appear as harmful as many other addictions. This is likely because tobacco products are legal and easy to get, and the worst side effects of abusing them take time to develop. Tobacco use claims more lives than any other addictive substance. Many smokers cannot quit despite knowing smoking's impact on their health. The addictive nature of tobacco is one of the reasons it is so widely used around the world. The nicotine contained in tobacco leaves is what fuels those addicted to it. Users are most likely to smoke cigarettes but can also use pipes, cigars, and dip to get their fix. Withdrawal symptoms start with a powerful craving for tobacco, followed by irritability, trouble sleeping, issues paying attention, and an increased appetite. What do you think about our video, the top 10 most common addictions? Let us know in the comment section below. As always, please remember to subscribe and turn on notifications so you don't miss many more videos like this. Talk to you all in our next video. Take care.